There's a growing consensus that the pandemic has taken a big emotional toll on young people. Among other troubling signs, children's hospitals across the country have seen more kids showing up in their emergency rooms for mental health reasons, seeking care for everything from severe anxiety and eating disorders to suicide attempts. The vast majority of Americans, -87%, are concerned about the well-being of the next generation, according to a new poll. In response to the crisis, a group of 17 national mental health organizations are calling for a new investment in school-based mental health support for kids. The group published a new report this week rating states based on how well they are addressing the crisis through programs and services in schools. The report highlights states that have invested in building a culture and system of care at schools that reduces the risk of emotional problems and ensures kids who are struggling don't fall through the cracks. This report card really aims to give us a better understanding and overview of what's occurred. And most importantly, where should policymakers be prioritizing their limited resources to help our youth in this time of crisis? The youth mental health crisis has been growing over many years. Recent studies show that the pandemic made things much worse because of its health and economic impacts on families, isolation, challenges with virtual schooling and ongoing stress and uncertainty. And mental health care experts agree that the solution will involve investments in many sectors, including families, communities, and the healthcare system. However, schools are increasingly being recognized as central to solving the problem. We need to have a range of services that are offered to children, through schools, says Miller, so that they can meet the range of needs that kids have. Some kids might just simply need to be more supported. Some kids might actually need to have more intensive counseling. Some kids might need to have access to social services that's going to allow their family additional benefits. The report grades states based on how well they've developed different kinds of programs and services to improve school and mental health. These cover everything from mental health education for students, training for teachers and staff, to access to school counselors and psychologists, says Angela Kimball, Senior Vice President of Policy and Advocacy at Inseparable, one of the many advocacy groups involved in the poll. They also include getting funding from Medicaid for eligible kids, developing partnerships with community mental health professionals, and policies that foster a healthy school climate.